Radiesse for patients, the kind of salient points about it, this really unique product has actually been around for a long time.
Yeah.
But definitely coming back into our consciousness a bit more. So we're going to talk about what is it, how does it work, what's it used for, and frequently asked questions that people might typically have, like, you know, how long does it last, etc. So what is it?
Radiesse is, it can be used like a dermal filler, so it is a filler of sorts, but it's known as a calcium hydroxyapatite. So it's not HA filler that you would normally be used to receiving in clinic. Radiesse is a collagen stimulator, so it has biostimulatory element to it, which means that it's going to increase in longevity, it's going to work over a period of time, and you're going to get basically more of an outcome than you would do with HA filler.
Yeah, so it's definitely got added benefits, basically, versus HA. So just like Emma said, you can use it like a volumizing agent, so basically as a like for like for hyaluronic acid. But what really makes it different is the fact that you get these ongoing collagen stimulating sort of effects that have an impact on the skin and skin quality generally, right? So then what do we use it for?
So there's a couple of different things I would say that it's most popular for. One would be improving skin integrity. So if you think of those areas where you notice skin laxity, particularly in the neck, which we know that I have noticed and had this treatment, and it worked really well. So where you just notice that laxity, we're able to inject the Radiesse in a hyperdilute form, spread it all over that area, and again, as Chris said, that collagen stimulation, improving skin integrity, and it works over a period of time. So it works brilliantly in the neck to cover that larger surface area. Other areas would be lower face, smile lines, accordion lines. And the other area that's actually quite popular is the hands, the back of the hands, where you can see sort of skin laxity and aging in the hands. So yeah, a lot of patients will like it for there as well.
So, I mean, I think it's probably, I mean, in the hands is probably, you know, where I think probably injectors will know it most commonly as, but in terms of patients, yes, you can use it to treat the hands in terms of rejuvenating the hands, but this use to improve skin quality in this hyperdilute form that Emma described. So basically what we do is we purposely make the product more liquidy. So you add basically a bit of saline and a bit of local anesthetic to make it a bit more liquidy, so we can spread it out over a large period of time, and the kind of particles of the product don't congregate too much, you know, because you want to spread it basically thinly, a little bit like we did in Emma's neck.
Another area that it's really good for is not in a hyperdilute form, but used neat basically, is the jawline. So really effective for sculpting the jawline, creating sort of that nice angular look, especially in males. If males come for jawline filler, it's really good in male patients for achieving that. So yeah.
No, absolutely, and the fact that you get so much more longevity. You know, because I think classically male patients, you know, they prefer to kind of, you know, if they could come once every 3 years, you know, one and done, boom, boom. It tends to be a bit more, I think, the kind of mentality of male patients a wee bit. But no, overall, brilliant product. And, you know, we both really like it.
Love it.